A very good morning. Hello, everyone. So, our today's class, the topic for today's lecture is cardiac cycle, which is a topic from cardiovascular physiology. So, if we define cardiac cycle, we can define this as the cardiac events that occur from the beginning of one heartbeat to the beginning of the next. So basically the cardiac cycle talks about the events that occur in one particular beat in heart. So whatever events that occur during one heartbeat, we describe all these events as they happen in a cyclical way, in a repetitive way. So we call this as cardiac cycle, and all the events that occur from the beginning of one beat to the beginning of the next, it can be described as cardiac cycle. Now, as you know, we have in cardiac muscle cells, we have two types of activities. First is the electrical activity, which is followed by mechanical activity. Electrical activity, the generation of impulse and conduction of impulse, that is to be discussed in different topic when we discuss about the pacemaker potential and the conduction system of the heart, and also the recording of these electrical activities, which we do by recording electrocardiogram. Here, in this, when we discuss about cardiac cycle, we only discuss about the mechanical events of heart. That is the process of contraction and relaxation. So, electrical and mechanical events occur in a coordinated manner to generate effective contractions. So, we are talking here about the process of contraction and relaxation which occur in one heartbeat, from the beginning of one heartbeat to the beginning of next. Now, if we talk about the duration of cardiac cycle, we can say the duration of cardiac cycle is about 0.8 seconds. So one whole cardiac cycle lasts for 0.8 seconds, but it will depend on the heart rate. So we can say this duration of cardiac cycle, it is inversely proportional to the heart rate. So if the heart rate is faster, the duration of cardiac cycle will be inversely proportional to that. So the duration will decrease. If the heart rate increases, cardiac cycle duration decreases. And if the heart rate decreases, the cardiac cycle duration will increase. So on an average, normally we say the cardiac cycle is of 0.8 seconds of duration. So if we take heart rate at 75 beats per minute, so that gives us one cardiac cycle of 0.8 seconds. For example, if the heart rate is 60 beats per minute, so obviously the duration of one cardiac cycle will be about 1 second. So 60 beats in 60 seconds, so one beat will be 1 second. So we take a normal average heartbeat 75 beats per minute, so normal cardiac cycle we take it as 0.8 seconds. Each beat of heart consists of systole and diastole, of atria and ventricles. So what does this mean? Basically, systole is nothing but the contraction of heart muscle, and diastole is relaxation of heart muscle. And this contraction and relaxation, they occur both in atria as well as ventricles. So both the atria as well as ventricles, they first contract and then they relax. And everything, all this process is happening in a cyclical manner, and that is why we say that this is a cardiac cycle. Then systole is the contraction of heart during which blood is ejected out from the heart, and as I said, diastole is the relaxation of the heart during which the chambers of the heart are filled with blood. Going to the next slide, the normal duration, as I said, is 0.8 seconds. Now, we can divide this cardiac cycle as atria and ventricular events if we try to discuss differently, because they are, although they are occurring simultaneously, but for the sake of understanding, we divide this cardiac cycle into atrial events and ventricular events. So atrial events, naturally there will be atrial systole and atrial diastole. So out of these 0.8 seconds, atrial systole or atrial contraction, it lasts for 0.1 seconds, and atrial diastole, it lasts for 0.7 seconds. So what does this mean is that atria, both right and left atrium, they contract only for 0.1 seconds. For the rest of 0.7 seconds, the atria is just relaxing, and during that relaxation period, it is receiving blood from the veins, from superior and inferior vena cava on the right side, and left atrium is receiving the blood from 4 pulmonary veins. Coming to the ventricular events again we have ventricular systole and ventricular diastole. Here ventricular systole or ventricular contraction, it lasts for 0.3 seconds, and ventricular diastole, it lasts for 0.5 seconds. Now these ventricular events we subdivide into different components. Atrial, simply there is 0.1 second contraction, 0.7 second relaxation, but ventricular events we divide it into sub-components. So what are those? We'll see. Before that, let us see this cyclic representation of cardiac cycle. So if we begin here, so it's 0, if we take this point as 0 reference point, so we begin with atrial systole. So this is atrial systole, it lasts for 0.1 seconds. And after this 0.1 seconds, the atria goes into diastole, into relaxation for 0.1, 2, 3, 4, 5, 6 and 7. So for 0.7 seconds, atria is under diastole or it is relaxing. Only for initial 0.1 seconds, atria contracts. Immediately following atrial systole or atrial contraction, the impulse now reaches the ventricles, and this outer ring represents the ventricular events. So immediately after atrial systole or atrial contraction, which lasts for 0.1 seconds, ventricular systole begins. And as we said in this slide, as we said, ventricular systole duration is 0.3 seconds. So here we see that as soon as the ventricular systole begins, it lasts for 0.1, 2 and 0.3 seconds. So 1, 2 and 3. So ventricular systole, ventricular contraction begins as soon as atrial systole is over, and this lasts for 0.3 seconds, following which the ventricle also goes into diastole or relaxation for next 1, 2, 3, 4 and 0.5 seconds. So 0.3 seconds is ventricular systole and 0.5 seconds is ventricular diastole. You can see here the last portion of ventricular diastole is last 0.1 seconds. It coincides with atrial systole. And from this diagram also we can see that both the atria as well as ventricle, this is the atrial circle, inner circle, and outer circle is ventricular events. So you can see both the atria as well as ventricles, they are relaxing together for 1, 2, 3 and 4, 0.4 seconds. So for 0.4 seconds, both the chambers, atria as well as ventricles, they are just relaxing. And for other period of time, the events occur separately but together. So this is how we can represent cardiac cycle in this diagrammatic way. Now, as I said that we don't have much to describe about atrial events. We simply have 0.1 seconds of contraction systole followed by 0.7 seconds of atrial diastole. Let us discuss about or elaborate the ventricular events, that is ventricular systole and ventricular diastole. So ventricular systole, as you can see here, ventricular systole, we divide it into 3 phases. Ventricular systole, that is the ventricular contraction phase, we divide into 3 subcomponents. First is isovolumetric contraction phase. After that follows rapid ejection, and after that follows reduced ejection phase. So this lasts for 0.05 seconds, and rapid ejection it lasts for 0.10 seconds, and reduced ejection lasts for 0.15 seconds. So total time for ventricular systole, if we add these three, it will come to 0.3 seconds. It will come to 0.3 seconds. And similarly, ventricular diastole, after this ventricular systole part, will begin the ventricular diastole. After contraction, ventricular contraction, now ventricle will begin to relax. So that relaxation phase or ventricular diastole is divided into 5 phases. So first phase is proto diastolic phase, that lasts for 0.04 seconds. Second one is isovolumetric relaxation phase, that lasts for 0.06 seconds. Then we have first rapid filling phase, 0.1 second. Slow filling phase, also called as diastasis, 0.2 seconds. And then we have last rapid filling phase that lasts for 0.1 seconds. And this last rapid filling phase, it coincides with atrial systole. It coincides with atrial systole. So if we add up all these components together, they will come to exactly 0.5 seconds. So ventricular systole, 0.3 seconds, 0.3 seconds, and ventricular diastole, all these phases together 0.5 seconds. So total duration is 0.8 seconds. So now, as I was telling you, the duration of cardiac cycle will depend on the heart rate, and they are inversely proportional. So as you can see here, when the body is at rest, one complete cardiac cycle lasts 800 milliseconds or 0.8 seconds. 300 milliseconds is systole and 500 milliseconds is diastole. So for all the practical purposes, now when we say diastole and systole, we are talking about ventricular systole and ventricular diastole. Okay, so at rest, much of ventricular filling occurs during the rapid filling phase. During exercise, diastole length is shortened much more than systole. I will show you how this changes. This greatly reduces the time available for ventricular relaxation and filling. I will explain in this slide. You see here, we have cardiac cycle duration at 2 heart rates. First is the normal heart rate, that is about 75 per minute. And second one is the heart rate at 200 beats per minute. So this is tachycardia. So we will see how does this cardiac cycle duration and duration of different components change when heart beats at 75 per minute and when the heart beats at 200 beats per minute. So obviously at normal heart rate, the cardiac cycle duration is 0.8 seconds and systole is about 0.3 seconds, 27 is about 0.3 seconds, and here duration of diastole is about 0.5 seconds. So this is our normal cardiac cycle duration at a heart rate of 75 per minute. Total duration 0.8, systole about 0.3, diastole about 0.5. When we increase the heart rate to 200 per minute, you see the duration of cardiac cycle reduces from 0.8 to 0.3 seconds. And systolic duration, it reduces from 0.3 to 0.16. So almost half of the normal duration, systole. And diastolic duration, it reduces much more than systole. It reduces from 0.5 to 0.14 seconds. So from this, the important point to note is that when the heart rate increases, the duration of diastole is affected much more than the duration of systole. You see, duration of systole goes from 0.3 to 0.6, so it is reduced half. While as diastolic duration is tremendously reduced maybe to 1/4. From 0.5 seconds, it is reduced to 0.14 seconds. So that means the importance of this point is that when the heart rate goes on increasing, say 150, 200, 250, 250, heart gets very less time to relax or to go into diastole. So when the heart gets less time to relax, so there is improper filling of blood. The heart doesn't get proper time, the ventricle doesn't relax properly, or the atrias to receive the blood. So when the blood received is less, so naturally the output will be affected. The stroke volume and the cardiac output gets tremendously affected when the heart rate increases above 150 or 200 beats per minute because of the drastic reduction in diastolic duration. So heart is not able to relax properly, heart is not able to receive the blood properly so that it can pump it out. Now, describing all these events that I told you that we discussed in this slide, ventricular systole, isovolumetric contraction, rapid ejection, reduced ejection phase, and ventricular diastole, proto diastole, and all these phases. We will just try to explain or discuss these events, how they occur. So initially during diastole, all the four chambers of the heart, that is both atria and ventricles, are relaxed and filled with blood due to venous return. So if we imagine to begin with, whole of the heart is relaxing, atrias are also relaxing and they are receiving the blood from veins, ventricles are also relaxing and they are also receiving blood from atria. And at this time, both atrioventricular valves are open, but semilunar valves are closed. See, we have two semilunar valves. That is, on the right side we have pulmonary valve, and on the left side we have aortic valve. At this time, when both the chambers are relaxing, both the valves, semilunar valves, aortic and pulmonary, they are closed. But the atrioventricular valves, on the right side tricuspid and on the left side mitral valve, they are open. And the blood is flowing from atria to the ventricles. Now, let us take first event. First event, what happens is that the impulse, when generated from SA node, it is conducted to atria, and the first thing is that atria contracts. So that is called as atrial systole. Atrial systole, and it lasts for 0.1 seconds. So atria contracts for 0.1 seconds and pushes or pumps the remaining blood through the atrioventricular valve into ventricles. So that is the first thing that happens. Immediately after this, what happens is that now atria is relaxing, ventricles now start to contract. By this time, when the atria goes into systole, by this time the impulse reaches from SA node to AV node and to the ventricles. And now immediately ventricles start contracting. Once the ventricles start contracting, so the pressure is built up, and because of that, the AV valves close. The AV valves close, semilunar valves are already closed. Now because of this pressure build up in the ventricles, because of this contraction, start of contraction, the AV valves close, and now ventricle is contracting as a closed chamber. So ventricle is contracting as a closed chamber, so we call this phase as isometric contraction phase. Also in this phase, since ventricle is contracting as a closed chamber, there is no change in the net volume, that is in the ventricles. The blood is neither flowing in nor is it going out, because both the orifices, both the openings, semilunar valve as well as tricuspid or AV valve, both the valves are closed. So blood is in the chamber and ventricle is contracting as closed chamber. So no change in volume also. So we call this phase as isovolometric contraction phase. Isovolometric contraction phase. Okay. Before this, as I said, there will be atrial systole which will last for 0.1 seconds. And if we want to note down the pressures in right atrium during this atrial systole phase, in right atrium it is about 4 to 6 mmHg, and left atrial pressure because of this atrial contraction goes up to 7 to 8 mmHg. So okay, coming to this isovolometric contraction phase, as I said, after the ventricles have filled by atrial contraction, AV valves close as the ventricles begin their contraction and intraventricular pressure increases. The semilunar valves remain closed and this makes ventricle a closed cavity. The volume in the ventricles remains unchanged throughout the contraction, hence the name isovolumetric contraction. So closure, and one more point to note here is there, when the isovolumetric contraction begins, it closes down the AV valves, and the closure of these AV valves, it gives rise to what is called as first heart sound. So we say that first heart sound is because of the closure of AV valves, both tricuspid as well as mitral valve. So closure of AV valves during isovolumetric contraction phase gives rise to first heart sound. So this isovolumetric contraction of ventricles, it lasts for 0.05 seconds. After this, what will happen is that because of the build-up of pressure, the ventricle goes on contracting and the pressure goes on increasing. Once the pressure crosses the pressure in the aorta on the left side or pulmonary artery on the right side. Once the ventricular pressure crosses that pressure, for example, on the left side crosses the pressure in the aorta, which is usually 80 mmHg. So the semilunar valves will open. Semilunar valves on the left side means aortic valve. That will open up when the left ventricular pressure goes more than 80 mmHg. 80 mmHg is the pressure, diastolic pressure in aorta. So when because of the ventricular contraction, the pressure rises steeply and it crosses the 80 mmHg pressure, the semilunar valve or the aortic valve will open. Same things will happen on the right side, but there is a pressure difference. In pulmonary artery, the pressure is not 80 mmHg, it is about 20 to 25 mmHg. Anyhow, for the sake of convenient explanation, let us stick to the left side only. Let us describe the events on the left side. Same things are happening on the right side, but with slightly low pressures. With low pressures, because right side circulation, as you know, is called as low pressure, low resistance circulation, while as left side circulation is called as high pressure, high resistance circulation. So for the sake of explanation, let us stick to the left side. So because of the ventricular contraction, the left ventricular pressure, it goes above 80 mmHg. So that is the pressure rises more than the pressure in the aorta. The semilunar valves, they open, which is also called as aortic valve. So aortic valve open and the blood which is in the ventricles, it quickly escapes through this aortic valve into the aorta. So this phase we will call as rapid ejection phase. This phase we will call as rapid because the blood is rapidly ejected into the aorta. The AV valve is closed, that is closed, so blood will escape only through this aortic valve or semilunar valve. So this will be called as rapid ejection phase. So this will be rapid ejection phase as you see on the slide, and this phase lasts for 0.10 seconds. As I told you, semilunar valves open, and during this phase, 2/3 of the blood volume, which is called stroke volume is nothing but amount of blood pumped during one heartbeat or amount of blood pumped during one ventricular contraction. So out of the stroke volume, 2/3 of the stroke volume will be pumped or ejected during this rapid ejection phase. And aortic pressure increases but slightly less than ventricles. So aortic pressure, as I told you, the diastolic pressure in the aorta was 80. Because of this rush of blood into the aorta, the aortic pressure also goes on rising. Ultimately, it reaches what we called as systolic pressure, that is about 120. So this is about rapid ejection phase. Now, after this rapid ejection, what will happen is, rest of the blood will follow and contraction will continue for another maybe 0.15 seconds, and rest of the blood will also be pumped into the aorta, and aortic pressure will further rise to 120 millimeters of mercury. You can see here. So that phase which follows rapid ejection phase is called as reduced ejection phase, because during this phase the blood will flow little slowly than the rapid ejection phase. and in a lesser quantity. As you see here, in rapid ejection phase, almost 2/3, suppose stroke volume is 80 ml, almost 50 ml is ejected during rapid ejection phase only. So remaining of the 30 ml or 20 ml will be slowly ejected during this reduced ejection phase. Okay, and this lasts for 0.15 seconds. So, and it also concludes or ends the ventricular systole. As I told you, these are the events that happen. The continued contraction of the ventricles pushes the remaining blood into the aorta and pulmonary artery very slowly. And at the end of this phase, the ventricles begin to relax. So this is the end of ventricular systole, or this is the end of ventricular contraction. So we have phase 1, isovolumetric contraction phase, lasting for 0.05 seconds, followed by rapid ejection phase for 0.1 seconds, and followed by slow ejection phase of 0.15 seconds. So total ventricular systole lasts for 0.3 seconds. Now after this, once the blood is pumped by the ventricles into the aorta on the left side, into the pulmonary artery on the right side, now ventricles begin to relax. So once the ventricles begin to relax, ventricular pressures, they immediately tend to fall down. When the pressure falls down and ventricles begins to relax, the column of the blood which was pushed till now, which was pushed up into the aorta, that falls down, and that column of blood, it closes the semilunar valves, both on right as well as left side. So now this phase starts the beginning of the diastole or ventricular relaxation. It starts with the fallback of the blood column, because ventricle is now relaxing, pressures are falling down, so blood column falls back and closes the semilunar valves. So that small event, it lasts very briefly for about 0.04 seconds. This event is called as Proto Diastole, just in the beginning of diastole, ventricular diastole. So what happens during this event? This blood column falls back and closes the semilunar valve. So Proto Diastole phase is the first phase of ventricular diastole or ventricular relaxation, and it lasts for 0.04 seconds. What happens, as I told you, just at the beginning of ventricular relaxation, as the intraventricular pressure decreases below the pressure in the aorta and pulmonary artery, the blood tries to come back into the ventricles, and this is prevented by closure of semilunar valve, which produces the second heart sound. This is the significance here, that this column of blood which falls back down in aorta and pulmonary artery, it sharply closes the semilunar valves, and this sharp closure of semilunar valves is the cause of second heart sound. So first heart sound was due to closure of atrioventricular valves, tricuspid or mitral. Second heart sound is produced by the closure of semilunar valves, both pulmonary or aortic. So this is protodiastolic phase. Immediately after this phase, what happens now? Semilunar valves are closed, atrioventricular valves are closed, and ventricles are now relaxing. In the systole, they were contracting as a closed chamber. Now they are relaxing as a closed chamber, because both the valves are closed. Both the valves are closed and ventricles are relaxing as a closed chamber. So this will be called as isovolumetric relaxation phase. And as you see here, this phase lasts for another 0.0 seconds. Okay, and in this phase, the ventricle is in a closed cavity which is relaxing. During this phase, the intraventricular pressure goes below the atrial pressure. Obviously, when the ventricle will start relaxing, especially during the isovolumetric relaxation phase, the pressures drop tremendously and very quickly, and the pressure goes down below that of the pressure in the atria. So obviously, when the pressure will go below the pressure in the atria, that will result in opening of the atrioventricular valves. So I think that is very simple to explain. Once, because of the relaxation of ventricles, the pressure drops down quickly, maybe up to 5, 4 or 2 mmHg, and while in the atria the pressure has now gone to maybe 6 or 7 mmHg. So once the pressure in the ventricles reduces or comes down below that of the pressure in the atria, immediately the atrioventricular valves will open. Because they are unidirectional valves, so they open down in the ventricles and there is rush of blood into the ventricles. And the ventricles get filled up with the blood. So naturally we will call this phase as first rapid filling phase. So this will be called as first rapid filling phase, which will last for 0.1 seconds. During this, so the AV valve is open and there is sudden rush of blood into the ventricles from the atria. So by this whole time when we are explaining these events about contraction and then relaxation, proto diastole and all, for this whole time, that is for 0.7 seconds, where atrias were relaxing and they were receiving the blood from the veins. Now as soon as the atrioventricular valve is open, there is quick rush of blood from atria to the ventricles and the ventricles get filled up again with the blood, and we call this phase as first rapid filling phase. And this first rapid filling phase, it lasts for 0.10 seconds. After this, the ventricle continues to relax for another 0.3 seconds, because total duration is 0.5 seconds. So after this, the ventricles continue to relax. Atria is also relaxing. AV valve is opening. So there is continuous flow of blood from veins into atria through the atrioventricular valve into the ventricles. So this becomes a continuous column of blood. The blood, you can imagine, is flowing from veins into the atria. Atrioventricular valve is open, so through the atrioventricular opening into the ventricle. So the blood is flowing slowly and ventricles are getting filled up. So this is called slow filling phase, also called as diastasis. So this is the longest phase in cardiac cycle as far as ventricle is concerned. So it is lasts for about 0.20 seconds. So that is reduced ventricular filling, also called as diastasis. During this phase, both atria and ventricles are relaxing. The AV valve is open. The blood entering the atria fills the ventricles passively. So this is what happens during this phase when ventricle is also relaxing and atria are also relaxing. After this diastasis phase, which lasts for 0.20 seconds, what happens is that now atria, by this time, the SA node generates next impulse and atria again goes into contraction. That is, we reach to the first part where we started. So atria goes into systole, 0.1 seconds contraction, and because of that systole, the blood again rushes quickly into the ventricles. And this, as we already have said, that atrial systole lasts for 0.1 seconds. So this last phase, during which the ventricles get again quickly filled by atrial contraction, this will be called as second rapid filling phase, or can be called as last rapid filling phase. So this last rapid filling phase, when ventricles are relaxing, this is because of the atrial contraction. This phase coincides with atrial contraction. The atria are in systole, forcing blood into the ventricles, which are relaxed. So this completes the whole cardiac cycle. We started with this last rapid filling phase, which coincides with atrial systole, and we came to this phase, and this ends the one beat, the events during one beat or the events during one cardiac cycle, as far as the ventricles are concerned. So we have, if we quickly go through again, here, in ventricular events, as I said that atrial events, nothing to discuss much. Atria contracts for 0.1 seconds and relaxes for 0.7 seconds. So atrial systole 0.1, atrial diastole 0.7. But as far as ventricles are concerned, ventricle systole lasts for 0.3 seconds. We have these phases: isovolometric contraction phase, rapid ejection phase, and reduced ejection phase, which is followed by ventricular diastole, protodiastolic phase, these are the durations: isovolumetric relaxation phase, first rapid filling phase, slow diastasis, slow filling phase or diastasis, and last rapid filling phase. This is the phase which coincides with the atrial systole. Atrial systole. Okay, now this was the brief discussion about this, and one of the important properties of atrial systole is that it acts as primer pumps, because during this atrial contraction only 20% of the blood flows to the ventricles. Rest of the 80% ventricular filling had already happened during the first rapid filling phase and the diastasis. So whatever blood gets collected in the ventricles during diastole, for example, it is about 120 ml, so about 90 ml or about 90 to 95 ml already gets collected during first rapid filling phase and diastasis. Only remaining 20 or 25 ml of blood is forced or pumped into ventricles by this atrial contraction. So even if atria for some reason is not efficient enough to contract, to pump blood, atrial contraction fails because of some reason, because of some pathology, atria is not able to pump the blood, still the cardiac output will be affected only by 20%, because the rest of the filling has already taken place even without atrial contraction. So atrial contraction only contributes 20% of the what we call as end diastolic volume. So coming to the pressure changes during cardiac cycle. So chambers of the heart show different pressures during various phases of cardiac cycle. Left ventricle will have higher pressure obviously than right ventricle, and both atria have lower pressures. So left ventricle has to pump the blood through the huge systemic circulation, so left ventricular pressure will be much more than the right ventricle. And during ventricular systole, left ventricular pressure reaches a maximum of 120 to 140 mmHg, while as right ventricular pressure reaches a maximum of 25 to 30 mmHg. So left ventricular pressure is much more higher than the right ventricular pressure. During ventricular diastole, left ventricular pressure drops from 140 to even 15 to 20 mmHg, while as right ventricular pressure can drop even up to 0 mmHg. So these are the pressures during diastole, ventricular pressures during diastole. Aortic pressure changes at the beginning of the rapid ejection 120 mmHg and at the beginning of ventricular diastole 80 mmHg. So these are the systolic and diastolic pressure in the aorta. So during the ventricular systole, the pressure can go up to 120 mmHg. When the ventricles start relaxing, or during the ventricular relaxation phase, the pressures are, diastolic pressure in the aorta are 80 mmHg. Pulmonary artery pressure again changes during ventricle. The systolic pressure in the pulmonary artery is about 25 to 30 mmHg, while during diastole it can reduce even up to 0 mmHg. Atrial pressure varies between 0 mmHg when relaxing to maximum of 15 to 20 mmHg during contraction. So these are the atrial pressure variation between systole and diastole. When heart is relaxing, so it goes up to 0 mmHg down, and when atria is filled with blood and when it contracts, the pressures can go up to 15 to 20 mmHg. So these are the pressure changes in the tabulated form which occurs during cardiac cycle, during systolic and diastolic. So you can see right ventricle, these are systolic pressures, these are diastolic pressures. Right atrium, okay, this is the pressure range. Pulmonary artery, these are the systolic pressures and diastolic pressures. Left atrium pressures, they range from 6 to 12, slightly more than the right atrium. And left ventricle, much more increased pressure, systolic and diastolic than the right ventricle. And aorta, we have 120 is systolic pressure and 80 is diastolic pressure. So these are the pressure changes during cardiac cycle. Now coming to the volume. Volume changes, we have one volume will be at the end of ventricular diastole, at the end of ventricular relaxation. The amount of blood present in the ventricle is called end diastolic volume. So it is between 110 to 120 ml. So So this is the total blood present in the ventricles, each ventricle has 120 ml end diastolic volume, the amount of blood present at the end of diastole. After this, the ventricle contracts. So this is called end diastolic volume, and out of this, the amount of blood pumped is called stroke volume. Okay, so that stroke volume, out of this 120 ml, about 70 to 80 ml of blood is pumped during one ventricular contraction. So you see, it is not 100% pumping of blood. Out of this 120 ml, the ventricle is able to pump only 70 to 80 ml of this. So remaining blood, that is end diastolic volume minus stroke volume, that gives us end systolic volume, which is that 120 minus 70, which comes to 40 to 50 ml. So this is the end systolic volume which remains in the ventricles after complete contraction, after complete systole. So these are the important volumes during cardiac cycle, and the fraction of volume of blood which is pumped each beat, that is this 70 ml. So 70 divided by end diastolic volume, that forms what we called as ejection fraction. So ejection fraction is an important entity. So it is percent of end diastolic ventricular volume that is ejected with each stroke. So it is about normal value is 60 to 65%, and it is a valuable index of ventricular functioning. If ventricular muscle is not functioning properly, so the stroke volume will be less. So naturally, this ejection fraction will reduce from 65 to maybe 50 or 55 or even down. So we say when we do echocardiography and all, we measure the ejection fraction. So it should be about 60 or above 60, which is nothing but the percentage of end diastolic volume pumped per beat. So this is what is called as ejection fraction. So percentage of end diastolic ventricular volume that is ejected with each stroke. That is this 70 ml out of this 120 ml, that gives us the ejection fraction. This is the graphic representation or diagrammatic representation of different events in the heart, You see, these are the heart sounds which are represented here. So first heart sound, that is when AV valves close here, this gives rise to first heart sound. When aortic valves close, this coincides with the second heart sound. Then we have third and fourth heart sounds. I will tell you about that. So this red graph is about the ventricular pressure curve. So you can see here, this is the ventricular pressure curve. First, this is the closure. This part is due to atrial filling, the atrial systole, when the ventricle gets filled with blood, and then the ventricular contraction starts, and this is about left ventricle. There is rise in pressure, and it crosses 80, it goes up to 120, and then the ventricles relax back down, and the pressure comes back down almost to about 0 to 4 mmHg, and it continues when the ventricle is relaxing for the rest of the time. Ventricle is relaxing. Again, when the atrial goes into systole, again there is a little rise in pressure because of that last rapid filling phase, and the second cycle continues. Rise in the left ventricular pressure and then comes back down. And this one is the atrial pressure, this dotted line. Same here, the atria contracts, then there is this small increase in the pressure here because of the bulging of the AV valves into the atria, and then because of the filling of blood, slow filling of blood, there is slow rise in the pressure, and it goes on rising, and then the pressure drops because the blood is emptied into the ventricles. That gives almost a 0 to 4 mmHg of pressure, and again the atria goes into contraction, and this is again the rise of about 5 to 8 millimeters of mercury, and the cycle repeats. This is the aortic, this dotted line here, these are the pressure changes in the aorta. As you can see, the diastolic pressure here, when the ventricle is under diastole, it is about 80 mmHg. So when the ventricle contracts and there is opening of aortic valves, the pressure in the aorta rises, it goes up to 120 mmHg. And here when the ventricles start relaxing, the pressure in the aorta, it comes down to its normal diastolic 80 pressure, 80 mmHg. And this here notch or this incisura, this is because of the rebound of the blood column again is the semilunar valves. So there is small and sharp rise in pressure here, but then again it settles down to the diastolic pressure of about 80 mmHg and the cycle repeats. These are the volume changes in ventricle. So it starts from end diastolic volume, that is about 120 to 130 mmHg, and when the aortic valves open, the ventricular volume is pumped into the aorta and there is drop in the end diastolic volume, and out of this 130 ml, about say 80 ml is pumped and what remains is 50 ml is the end systolic volume. Then again the ventricle gets filled during relaxation, and again the end diastolic volume reaches about 120 to 130 ml, and again next cycle begins and the blood from the ventricles gets pumped into aorta and there is drop in the volume and same thing continues. Now coming to quickly to the last part of this class, that is heart sounds. Already I have told you that there are first and heart sounds which are caused by closure of AV valves and semilunar valves, but on the whole we have 4 heart sounds. So 4 heart sounds can be recorded by phonocardiography, but normally only the first and second heart sound are audible through a stethoscope. So we have S1, S2, S3, S4. S1 caused by, that is heart sound 1, caused by closing of AV valves, and S2 caused by closing of semilunar valves. Heart sound 3 is associated with blood flowing into the ventricles, that is first rapid filling phase, and fourth heart sound is associated with last rapid filling phase or atrial contraction. If we see the characteristics of these sounds, so first heart sound, as I told you, due to closure of AV valves, it is a low frequency sound and it is heard by stethoscope as the sound lub, and the duration is about 0.15 seconds. So it is characterized by prolonged loud sound and best heard by stethoscope at mitral and tricuspid area over the chest. So we have different auscultatory areas on the chest. So this first heart sound is best heard over mitral and tricuspid area. So low frequency sound heard as lub, that is first heart sound because of closure of AV valves. Second heart sound is due to closure of semilunar valves. It is a high frequency sound. It is heard as dup, okay, and duration is less than the first sound, 0.1 seconds. And this sound is characterized by short, sharp sound and best heard by stethoscope over aortic and pulmonary areas over the precordium or over the chest. So this is the characteristic of second heart sound. You can see they coincide here: first heart sound, second heart sound, third heart sound, and fourth heart sound in close association with first heart sound. Murmurs, if we want to know, murmurs are nothing but they are abnormal, you can say abnormal sounds originating from different vessels or originating from heart. So murmurs are abnormal heart sounds usually associated with cardiac disease. Blood usually flows in a laminar fashion, but when the flow gets turbulent, the sounds associated with murmurs occur when blood flow becomes turbulent. Laminar flow, this type of blood flow usually does not produce any sound. So normally the blood flow is laminar, but because of some aortic, some valvular obstruction or some narrowing of arteries and all, the blood flow may get turbulent. That can give rise to these abnormal sounds which are called as murmurs. So we can have stenotic as well as insufficient valves. So this can give rise to different types of abnormal heart sounds. Stenotic means a narrowing of valve, and incompetence or insufficient valve means the valve is not competent enough. A valve that cannot close completely, usually because the valve edges are scarred and do not fit together properly. And stenotic means a stiff narrowed valve that does not open completely. So we can have valves which can be stenotic valves or insufficient valves. Both these types of valves, they give rise to abnormal heart sounds which can be called as murmurs. So this was a brief discussion about cardiac cycle, the events during systole, during diastole. We had atrial events, okay? We had ventricular events, and ventricular events were subdivided into different components. And normal duration of cardiac cycle, as we said, is 0.8 seconds, and cardiac cycle is nothing but events, mechanical events occurring during one heartbeat, from the beginning of one heartbeat to the beginning of second heartbeat. So to summarize, the conduction system and the atrial and ventricular muscle in the normal heart work in an extremely well coordinated manner to ensure correct opening and closure of the atrioventricular and sublunar movement of the blood through the heart in an appropriate direction with minimal regurgitation. So this is about how the heart works in coordination, both the electrical as well as mechanical components, to produce what is called as a normal efficient stroke volume, which gives rise to a normal cardiac output, which is important for the normal perfusion of body tissues. Okay, so thanks a lot. Thank you for your patient hearing, and see you again in the next class with some new topic. Have a good day. Thank you.